At the Institute for Continuing Healthcare Education, they say that healthcare is not delivered in silos, and so neither should professional education.
The best care possible happens in a team-based environment where the physician acts as the primary point of contact, but he collaborates with an interdisciplinary team of professionals. And as a team, the care is developed for the patient. We take that type of approach when we develop education.
I think the Institute is unique in terms of developing innovative education. We are trying to think out of the box. We are trying to do things that will inspire healthcare professionals to be better at their trade.
Continuing education activity planning begins with the identification of educational needs for the targeted audience.
The education cycle starts by identifying educational gaps in the practice setting. And an educational gap is defined as what ideally should be happening in practice and what actually is happening in practice, and the discrepancy that may exist between that.
Throughout the year, we'll put together a variety of different programs, be they live programs, be they online programs, be they print programs, that meet specific educational gaps that we have identified during our research process.
It's not going to be quantitative, it will be qualitative.
When we are developing our programs, one of the things that we always try to do is build in ways so that the audience can interact with the actual education itself.
It's continuing education that keeps the learner in mind that we're not, in academia because we want to read more. We want to be able to interact. We want to see things in an exciting and very, visual way, and also to take into account that patient care is what we're focused on.
I think the evolving role of the pharmacist as the healthcare team is evolving. I think is really pushed more into the forefront, that they want pharmacists' involvement on daily patient care rounds. They want them talking to the patients on a daily basis. And because of this, the patients are going to ask questions directly to the pharmacist in addition to the other healthcare providers. So it's really important that the pharmacists are well educated.
Several theories of adult learning suggest that it takes 3 to 5 educational and interactive interventions over time to initiate and sustain a change in knowledge or behavior.
Changes in behavior are sustained with multiple interventions. First, the education has to be valuable and engaging, but one intervention is not enough. It may start off as a live event that we will follow up with practice pearls or reinforce some of the education. In many cases, what we will do is take that outcome data and distribute it to the learners because it's very valuable what their peers experienced with this particular intervention, as well as how they compare to everyone else.
The data is used in many different ways. First and foremost, we look at the data to see how are learners acting differently. Is it that their knowledge has been enhanced? Has their application been enhanced? Or has their performance been enhanced?
It's important that educational learning objectives are measurable because we are looking to impact or to change a clinician practice in terms of their knowledge, competence, or performance in the practice setting. Designing a measurable learning objective enables us to do that.
The data also helps us to measure change in patient outcomes. And that's equally as important. So it's a win-win situation. It's a win for the learners in terms of enhancing their overall knowledge and their medical ability, as well as improving patient outcomes and quality of life.